Welcome learners. In this particular session, we will be talking about nasogastric tube insertion and feeding. Talking about the definition of the procedure, feeding given to patient through a tube inserted into the stomach through the nose or mouth is known as nasogastric or orogastric feeding. The purpose of nasogastric and orogastric tube insertion are giving feeds, for giving medications and gastric decompression. So basically nasogastric tubes and orogastric tubes serve these three purposes. Talking about the indications of NG tube insertion and OG tube insertion, the indications are feeding unconscious patients, feed psychiatric patients who refuse to eat, feed patients after oral surgery, feed patients with conditions affecting mouth, throat and esophagus, feed premature babies, and for abdominal distension. The methods of feeding. Feeds can be delivered by any of these two methods. The first method is continuous method, that is giving of feed via drip, and the second method is intermittent feeding, that is giving feed via syringe or in form of bolus. The general instructions for nasogastric tube insertion and feeding are: reassure the mother and the child, check the placement of the tube before feeding, check the temperature of the feed before administration, do not push air with the feed, do not push the feed forcefully, check the amount of aspirate before giving the feed. If it is more than 25% of the previous feed, withhold the feed and inform the physician. The articles that are required for NG tube insertion and feed are a Macintosh with cover, a tray containing Ryle's tube of appropriate size, bowl with gauze pieces, lubricant, container with water, swab sticks. Now I will be demonstrating the procedure of nasogastric tube insertion and feeding. So for the procedure, we need a tray containing nasogastric tubes or the Ryle's tube of appropriate sizes. For infant feeding, we need a catheter of 5 or 6 French size. We need syringes of various sizes, a 5 cc syringe, a 10 cc syringe, a 20 cc and a 50 cc syringe for children, a pair of clean gloves, a bowl of water to check the placement of the tube, feed in bowl, and an adhesive plaster. To begin with the procedure, wash your hands first, wear clean gloves, take the nasogastric tube, open the tube like this, keep the tube coiled in your working hand, this tube has to be measured from the tip of the nose to the earlobe and from the earlobe up to the xiphisternum. So this is the length of the tube that is to be inserted from the nostrils or from the mouth of the baby. Before we start inserting the tube, lubricate the tip of the catheter. It has to be lubricated with the help of a lubricant, a water soluble jelly. Apply the jelly on the tip and flex the head of the baby. Insert the tube from the right nostril and insert the tube up till the marked length. Do not push the tube forcefully. Once the required length is inserted, the tube has to be checked for placement. There are three methods to check the placement of the tube, whether the tube is in the stomach or if it is in the trachea. Syringes of various sizes like 5 cc, 10 cc, 20 cc and a 50 cc syringe, ounce glass measure, feed in a container, adhesive plaster and scissors, a face towel and clean gloves. Coming to the procedure, wash your hands first, collect all the articles and keep on bedside, review the physician's order or type and frequency of feed, put the patient in supine or Fowler's position, wash hands, clean the nostrils if needed with wet soap sticks, measure the tube from tip of the nose to the earlobe and from the earlobe to the xiphisternum and mark it. Place the Macintosh and towel over the chest of the patient. Take the Ryle's tube and lubricate its tip and hold it in such a way that the tip is pointing downward and introduce it into the nostrils. Flex the patient's head slightly and insert the tube up to the measured point. Check that the tube is in stomach by any one of the following methods. Dip the end of the tube in a bowl of water and watch for bubbles. If a continuous trail of air bubbles comes out, that means the tube is in trachea. Immediately pull out this tube. Second method to ensure whether the tube is in stomach is aspirate with syringe and note the gastric contents. If the gastric contents come through the tube, that means the tube is placed properly into the stomach. The third method to ensure the placement is introduce about 5 ml of air and listen to air gushing into the stomach with the stethoscope. If the tube is in the stomach, there will be hardly 1 or 2 bubbles coming out if we dip the tip of the tube in a bowl of water. If we see a gush of air bubbles coming out through the tube, that means the tube is in the trachea and this tube is to be pulled out immediately. Clamp the tube and close it. This tube is in the stomach. There is one more method that we can use to check the placement of the tube. With the help of a syringe, we can aspirate the contents of the stomach. Clamp the tube first, open it and try to aspirate the contents. If we see the content rising in the tube, that means the tube is in the stomach of the baby. This tube is correctly placed. Clamp the tube again and disconnect the syringe. Another method that we can use to check the placement of the tube is by inserting small amount of air into the abdomen. Fill the syringe with around 5 cc of air. Put a stethoscope and push the air with the tube. The stethoscope has to be placed over the abdomen of the baby and try to listen to the gush of air. If that sound is heard in the abdomen, that means the tube is in the abdomen. If no sound is heard, that means the tube is in the trachea. That tube has to be pulled out immediately. Once the placement of the tube is ensured, it is to be fixed either to the side of the cheek or on the forehead. The tube can be taped over the forehead of the baby like this. The tube is now ready for feeding of the baby. So any of these three methods can be used to ensure that the tube is in the stomach. Fix the tube with adhesive plaster over the nostril or the forehead once you have ensured that the tube is in the stomach. Attach the barrel of the syringe to the tube and pour the feed into it. Let the feed flow freely. Refill the syringe before it empties to avoid introduction of air. After the feed is given, a little amount of water is poured into the barrel to flush out the tube. Clamp the tube and make the patient comfortable. Record the time, amount, type of feed given and any other pertinent observation. Clean and put back the articles. Before we begin feeding the baby, check the placement of the tube by aspirating the contents. If we aspirate around 25% of the previous feed, the next feed has to be withheld. Notify the physician in case of abdominal distension or retention of the feed. In case there is no retention, the baby is now ready to be fed. After checking the placement of the tube, place a face towel across the chest of the baby to avoid any spillage on the clothes of the child. Clamp the tube first and open it. Attach the barrel of the syringe to the tube. Pour the required amount of feed release the clamp and let the feed flow freely. Let the feed flow. Add additional amounts if needed. Once the required amount of feed is given, flush the tube with little amount of drinking water. It can be like 2 to 5 ml. This will prevent blockage of the tube. Flush the tube with water. Do not push in air. Clamp the tube again and remove the barrel of the syringe. Close the tube and make the baby comfortable. After giving the feed, we can keep the baby in right lateral position or in semi-fowler's position as the baby is comfortable. Now do recording and reporting and wash your hands. Talking about removal of the nasogastric or orogastric tube. For removing the tube, pinch it and pull it out gently. So this is all about the procedure of nasogastric or orogastric tube insertion and feeding. Thank you.